The Cherokee Nation is suing 6 large drug distributors and pharmacies, citing an opioid epidemic of unprecedented proportions. The suit was filed in Cherokee Nation court, and it's the first time a tribe has taken this kind of legal action. The suit is similar to other lawsuits filed by several states, including most recently Oklahoma. Attorney General for the Cherokee Nation, Todd Hembree, says the epidemic has impacted thousands of lives across the nation's 14-county district.
I would say that there's not a Cherokee family that doesn't know someone that is affected by this crisis. Whether it is a son or a daughter or husband and wife that is addicted, whether it's a grandmother that's having to raise their children because their grandchildren because their son or daughter can't handle them anymore. It may be someone who can't get a heart treatment or a cancer treatment because our contract health dollars are being expended on caring for the opioid addiction. Maybe a police officer that has to deal with the crime that we have seen skyrocket in this area. So you don't know what's going to wash up on our shores because of this, but it's there, and it is personal.
Officials say the crisis has not only overburdened the nation's healthcare system, but also its foster care system. Tribal leaders say the epidemic is putting the tribe's future at risk.
The strain starts with an investigator who has to go and observe a child having the tremors, the respiratory distress, that baby being shipped off to a Tulsa hospital, my staff having to drive additional mileage in order to check on that child. The stress of trying to find a foster home that's willing to accept a child that from day one already has special needs. They're coming off of withdrawals, they're in the NICU, you're going to need specialized training in order to care for this child. They're going to cry uncontrollably. You have to prep that foster parent and ask, will you accept a child in this type of condition? So, the strain starts from day one, from the stress on the worker of seeing a child in that condition, from having to go longer distances to visit that child, foster parents willing to take the child, and then my department having to assist that child with additional hospital visits, additional care because they have cognitive developmental delays. If the parents are able to correct the conditions to get the child back, the length the child's in our custody and everything that we have to do in order to try to get that parent drug-free. And then in the end, is the parent able to get the child back, and do we have any possible adoptive homes for this child?
Hembree hopes a win in this case would include a significant hit to the distributor's pocketbook, along with potential lawsuits from other tribes and state governments.
Everyone will say, we're looking for a lot of money. Yeah, we are. We're looking for a lot of money to make it hurt. But it's really not about the money. And I hate it when people say it's not about the money, because it always is, okay? But what we want to achieve here is a change in behavior. And the Cherokee Nation suit alone is not going to do that. But the dominoes have started to fall. And state after state is bringing lawsuit against this industry. And eventually, that will change the behavior.
Jurisdiction will be a big hurdle for the tribe. The Cherokee Nation must convince a federal court it has the legal standing to sue non-tribal entities. Legal experts say that if the tribe is to win, it would be a huge victory because the U.S. Supreme Court would be acknowledging that the tribes have the legal authority to protect their people's health.